The first and foremost is that the process of addressing the need of an athlete is first to have a thorough interview with the athlete, figure out some of the histories, some of the injuries, and the sport he's practicing.
I'm Jackson Greaves. I'm from Fergus, Ontario. I play rugby for Highland Rugby Club.
Jackson Greaves is a young and upcoming rugby star, and we worked today to create a functional mouthguard for him to increase his performance with muscular strength and recovery.
Well, today at the Dental Center, or something like that, we are going to provide Jackson a IMS SPORTSGUARD. He's in for a treat because we are going to do a full workup on him that we would do on an athlete to provide him a partial stability, better airways, and improved performance. So I look forward to fitting you with this, and I hope you enjoyed the day. It might be a long one.
Yeah, I look forward to it.
Welcome.
Thank you.
And one of the measures we do with this platform is how is the posture stable. So the less you move, the more stable you are.
Right.
So we have certain measurements that we do with this, and that gives us an insight, is the person stable or not? And that center of pressure is the force resultant of all the forces on the ground. Okay. So it's
the average.
But it's not the projection of center of gravity.
Right. It'll be interesting to be able to get on it. Where from the center of gravity is
the center of gravity projection is going to change based on the body, on the body angulation.
Yeah.
Okay. This doesn't take into account the center of gravity. It basically takes into account the forces, the resultant forces of all the forces against the ground. Okay, what is its current condition? What are we dealing with? And then is using some of the biometrics, objective data to measure, okay, what is going on with his jaw? What's going on with his muscles? What's going on with his airway? And then say, okay, how can we change this? Can we improve it? And one way that I can improve it as a dentist is providing it with a proper fitting mouthguard.
As you can. $57.
Just try that open. See it moving ahead. It's just the jaw that opens. Yeah.
There you go. So you're going to have to open as wide as you can. So walk right as wide
As wide as you can. Yeah.
Not the head. Walk, tap, walk, tap, walk, tap, walk, tap.
And what we use is the joint vibration analysis.
So what is
And
that?
jaw tracker. So that is an apparatus that allows us to measure the vibration inside each joint as the jaw is opening and closing rhythmically. But at the same time as we measure that vibration, we also measure how the jaw is moving, how fast, how wide, and so on. And that gives us an insight as to the muscular function, but also the intracapsular function of the joint. I'm going to ask you to clench your teeth 3 times like this, okay? So try it. Clench, release, clench, release, clench, release. Wow. Got it. Nice one. Well done. Well done. The next step that we do is we look at the muscles. So surface muscle EMGs, which is basically how is the muscle reacting. We measure the electrical activity of each muscle at rest, in function? And is there some synergy, or is there some interaction that needs to be improved? Like somebody at rest, muscle at rest has a screw very low level, but if at rest the muscles are not at a resting level, that means something is causing that muscle to stir him up. So either we have a structural issue, either we have a functional issue, but something is not quite right and that muscle is not in a state of relaxation. Okay, and knowing that at the start allows us to say, okay, this can be correlated with postural issues, it could be correlated with dental issues, this could be correlated with an injury.
Right.
So that's why it's nice to gather that information.
Face toward me. Okay. How do you feel when you're standing?
We brought in Adam Ridgewell, who's a posturologist who works with posturology.
Okay.
And posturology is basically an assessment of whole body posture and how the podal captors, mostly, which is at the feet, have an effect on the whole posture. So I'm working down,
Right.
he's working up,
Right.
and we meet in the middle because the body is not is a structure, that very complex structure of interactive systems. And these systems, especially for posture, have different captors at different levels. And we need to try to optimize each of these captors to allow the body to be in its best possible stability for posture.
Hi, my name is Adam Ridgewell. I am an osteopath by trade. I'm also a massage therapist, and I also use something called posturology, which is the study of posture from a podal standpoint, so from the feet up and from the eyes down. The osteopathic role in his recovery and performance is to make sure that his body is functioning as a whole, efficient whole, so that his performance in the gym especially can be symmetrical, and his recovery process from workouts is optimum. And therefore giving him a better chance for his risk of injury to come down, his optimum performance to go up, and for him to be able to play longer on the field with less injury.
I got a little tiny bit of knee pain right now.
Whereabouts? Right or left?
Right in there.
Yeah, the right side mostly?
Yeah.
Okay, that's the side that you busted.
Yeah.
Yeah, has that been for a while?
Yeah, I've been having knee pains for some time now.
Okay, cool. So this is just a straightforward posture examination. This is where I hate doing this part because I've got to do it within, sort of a minute or so, 2 minutes. So I'm not going to be nice. I'm just going to say do this, do that, do this, do that. Okay, so let your arms relax to the side. Nice, relaxed. Good. So I'm just going to show you that which is longer, left or right.
Looks like my right.
The right side longer, yeah? See that? So the right side longer here. I didn't pull that right out, did I? No, it's just, I'm just putting it in front of you, okay? I'm going to check the level of your hips now, okay? So I'm going to put my hands on the top of your hips here. Try to release if you can, relax. So there's the top of one, you ticklish?
Oh, a little bit.
That's the top of one there, yes? You agree?
Yep.
And there's the top of another one right there.
Yep.
Okay, I want you to put your palms on top of my hands and let me know which is your higher side.
Well, I can't really tell.
You can't tell? Just let your hands relax. Mom, is Mom there still?
Yeah,
Which is your higher side here?
looks
Mom?
like the left.
It does, eh? Can you feel that the left is higher or not? You don't have to
I can
feel
see
it.
that,
Yeah. Okay, so your left is higher, okay? Let's relax there. So, left is high, right is low. Left is high, right is low, yes?
Yeah.
This is what we term in this protocol an eye dysfunction. Okay, so your eye is the main receptor of information that's going into your brain that's maintaining this posture. Okay, so now I want you to bring your hands to the front of your body like this. Good. Just do that. You can see that right side is longer, eh? See that? Okay, so that's pretty good. I want you to bring this right foot forward a little tiny bit, just creep forward, hold it there. That's perfect, you're right on that line now. Okay, so I'm going to look down your body. So I'm going to try to look down your body. You'll feel my head at the back of your spine. So we have the left, what we call posteriority. So your left butt cheek sticks out a little bit more. Okay. And your right shoulder goes forward. So in a way, what's happening is this right shoulder is going forward and your left butt cheek's going backwards. So you've got like a twist here and a twist there. Okay. So this is another eye dysfunction, this rotational plane. If you did like a black pepper grinder twister, that's a foot problem. But you're going backwards both ways, so that's an eye issue. So if theory holds true, if we change the eye, we might have a change in the twist of your body. But we have to start from the feet up too.
And then my last concussion in England,
Yeah.
I realized when I stood up, my like the horizontal plane was this.
I love it. Yeah.
It was like
Oh, wow.
shifted.
Yeah.
So when I stood up,
Yeah.
everything that I was seeing was 90 degrees sideways.
Wow. So you had to somehow accommodate for that.
Yeah, well, I just shook my head until it was straight again.
Can you see my hand here? Yep. My hand, not my arm, my hand. Yep. Yeah. Can you see it here? Yep. Can you see it here?
In my peripheral?
Yeah. Can you see it here? Yep. Okay, good. This way here. Okay, good. Can you see my hand here? Yep. Can you see it here? Yep. Can you see it here? Yep. Can you see it here? No. Can you see it here? Yep. Okay, good. You can see more around to your left. Put your palms like this out. Like this. You okay with it?
Yeah.
Good. Bring your palms backwards like that so they're pointing up and down. I'm going to try and pull this down. I want you to try and stop me. Okay, ready? 1, 2, 3. Okay, good. Smile. Ready? 1, 2, 3. Much stronger this side. Eh? Yeah. I was able to break his left side. Okay, cool. So that's your what we call your default. This is Jackson Grieve 1.0 default. We want to make it a 2.0.
So now we're dealing with two issues at the same time. So for me to help him, he needs to be involved absolutely. Because there's no way I can correct this without correcting that.
I want you to march up and down like that. Cool. That's good. How does that feel?
All right.
Okay, now I want you to close, keep going. I want you to keep going, and I want you to close your eyes. And don't open them until I say, okay, mate? Okay, good. Stop there. So you see he has this tendency to shift left there.
Yeah.
So even when he's moving, he's pulling this way.
Yeah.
So his eye, which we've seen, the parallel lines, hips and shoulders,
Yeah.
pointing to an eye dysfunction. His shift left when he's moving, his right eye is very strong and has to go that way.
That's
This would not happen if he kept his eyes open.
Thank you. And just same thing. That's like this. Okay. Look away. Make this solid. Clock.
Wow.
I can do a chin up on his arm now.
See? You're gonna make it way better.
Yeah, man.
Oh!
Oh, buddy.
Oh! It's okay, don't worry. So still on standby, that's right. Okay, relax, slow down.
Did you feel that, buddy?
I felt it. Not him, I felt it. Hey guys, I'm Dr. Raj. I've come in all the way from India, the magical land.
Yeah.
Relax. That's good.
Look at me right here. I would have a little tiny bit more myself.
To the left. When Patrick shoots the phonetic bite, I could help him, see how equally good the tense bite is. With the jaw tracker, you're a little more precise.
Oh my. So this is hitting hard already.
And the straps aren't jumping at all.
No.
So you're increasing frequency?
Yeah. And still shifting to one side. So there is a problem in the neck muscles.
So what we see here, because we're not recording, we're actually seeing every pulse that is getting pump, 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 pump. So it's a constant pulse, always at the same low frequency that is activating the muscles, but also the nervous system. Because the tensing is not only affecting nerve and muscles, it's also affecting the brain, the central nervous system, because it's affecting the opioid receptors, and it's going to cause a bit of, if you like, high within these opioid receptors in the central nervous system.
So what we normally do is we get the posturologist or the physiotherapist who works with us to, so he's going to do all the checkups that things like you did, and post TENS he's going to work on it, and then we shoot the bite, so we get a better bite.
Okay.
Because these muscles are going to change, decide where the jaw has to be.
So you actually get physical therapy right after this?
Right after this, and then we shoot the bite.
And what about remeasuring?
Yeah, it's all done along with that. Yeah, after the physiotherapist works on it.
Yeah, you then remeasure?
We remeasure.
Okay.
Yes.
Okay.
So in the clinic here, what we do is, as soon as the TENS is done, MAT scan.
Oh, yeah.
Yeah, MAT scan right away.
Okay.
That way we have a baseline post-tensing. And that baseline post-tensing is going to be compared to the bite or the treatment position afterwards.
Okay.
So we check, relax. So we check the muscles.
Yes.
We don't want them to go into fatigue.
I mean, we have contraction happening always at the same rhythm.
Okay.
So it's a constant rhythm, constant stimulation. So what that's going to provide for the jaw is a constant movement, constant path, which is called the myopath.
Myotrajectory. Yeah.
Myotrajectory path.
Okay. Oh, I see. Okay.
That means is the way the jaw opens and closes in the relaxed state of the musculature.
Right. Okay.
Okay. And that's where we try to get that neuromuscular bite in, is on that path.
Right.
Within the resting range.
Yeah.
Get your teeth together. Get your teeth together. Okay. Okay. Slowly open. Slowly open up. A little more. Open. Stop. Stop. Open up a little more. A little more. Yeah, there. Okay. Now I want you to. Oops, Daisy. Open now. Okay. Now I want you to move your jaw a little to the left. Slowly. There you go. Stop. Stay there. Go a little back. Nope. Move to the left. Okay. Close a little. Let go.
You can stick out your tongue, right? Yeah, just like that, so the pace is just flowing everywhere, but in your throat. You're doing great. Almost there. Open wide. So we have a perfect impression. And we see all the frenums, every teeth, even the wisdom tooth, and very good soft tissue. So that's awesome. We have everything, soft tissue, freedom. We're good to go. I'm delimiting the palatal seal for the mouth guard. Because one of the key issues is to simply have a palatal seal so it doesn't dislodge. So that's where I'm going to cut it. So this is the first layer. Then we'll add the second layer. Different color.
That looks awesome.
And let's give it the final touch. Final layer.
Oh, I see.
So as I release it,
Yeah.
now we have an exact indentation of the bite at the proper position that we found.
Yep.
Now the key to this now is to simply adjust it properly, because even though we have it nice and neat indented, I don't know if the forces are equal.
Okay, so can we use this now on him now and measure?
I need to polish and separate polish,
Okay.
absolutely, and we will.
Okay, beautiful.
It's one of the fingers. I'm gonna let you try it, then do a final polishing just to see if there's any spot that rubs.
Put it in.
If you want to. Now you're dying to. How's it fit?
That's secure.
Anywhere you feel that's rubbing too hard, causing any discomfort?
There's a little bit of a pressure on, like, on my bottom teeth. It's so like that part sits behind my bottom teeth, and I feel it presses a bit more than the rest. But
Other than that,
other than that, it's great.
perfect.
Yeah.
Let's go show the rest of the gang and adjust it, then do a final polish at the end. The beast is here.
Oh, dude.
Hey man, get that guy up close to another prop forward. It's gonna go now.
Hey, you're gonna go show that to Joe. He's gonna go bloody hell.
How does it feel? How does it feel?
It's good.
Feel good?
Oh,
Solid.
that's hilarious.
Man,
I like it.
that is awesome. Gold right in your face.
Yeah.
Nice, man.
Smile.
That's
That's
excellent.
great.
Oh, cool.
Yeah.
That comes out and
Jeez.
okay, just like that.
It's a great gold.
And it goes.
It's beautiful.
Nothing like any of the other ones you've
Number
had.
one.
Yeah,
man.
no.
Number one.
Nothing.
Look at that.
So you're gonna wear that in the gym now, even when you're lifting weights and everything.
Exactly.
Squeeze to the head, squeeze together, tight, open. Again, squeeze as hard as you can. Not by much, no. Not by much. Forward making.
Okay, can you take it out? So that's low. Okay, pop it back in.
Sorry, 1 second.
All right. Tell me when it's in. Okay, good. As soon as you put it back in, you youngsters, it shifts back up. Yeah. So you're level now with your bike pain here. Good. This guy is almost perfect.
Solid.
Get him on the.
That's good. Let's get the dude.
But then also when you repeated the test after putting the mouth guard in, he was like rock solid, and the swaying tightened up so that he was hardly swaying at all. And when you tested his strength grip, it was much stronger. I mean, just watching the confidence grow in him as he became more and more and more stable. I mean, I think that that is amazing. I think that's amazing because for the last few years, we've gotten mouth guards. And, you know, we've gotten the most expensive ones we could buy, but they never achieved for him what was achieved today with this mouth guard.
I'm really happy with how it turned out. It was a process, but in the end, I'm glad that I have it now. It's improving my balance and overall strength, so I'm pretty happy.
Hello, my name is Dr. Patrick Girouard. This weekend we held the weekend on SPORTSGUARD, the IMS SPORTSGUARD, and sports dentistry and sports performance. My role in this venture was basically being the catalyst and being able to bring some people together and having a live presentation treatment of an elite rugby player. I think that was a very successful event, and where we've been able to show through practical and clinical example what we're capable of doing and how the mouth guard is actually helping the athlete in his posture and in his performance.